Worrying news out of China. The country is reporting a large spike in the number of cases of a new form of viral pneumonia. And it comes as China gears up for the busy Lunar New Year travel rush. 217 people in China have been infected with the virus, including 5 cases in the capital. 3 patients have died. Health authorities in the city of Wuhan, where the virus appears to have originated, said an additional 136 cases have been confirmed. Canada is adding health screening questions at airports in Vancouver, Toronto, and Montreal. The U.S. is screening all passengers on flights from central China. Joining me now with more is Dr. Kamran Khan. He's an infectious disease physician at St. Michael's Hospital in Toronto. Doctor, good morning. Tell us about
Good
this
morning.
virus and what makes it unique and, in some cases, deadly.
Well, this is a virus caused by a type of virus called coronaviruses. And this is something that is a new virus that we haven't seen before in humans. What we know at this point in time, as you've indicated, is that there have been 3 deaths to date. And some of the illnesses have been quite severe. Now, coronaviruses are also known to cause common colds. But these type of newly emerging coronaviruses in some instances can be quite deadly. In fact, the SARS outbreak we saw in Canada in 2003 and really throughout other parts of the world was also caused by a coronavirus.
How is this virus spread?
Well, the virus, in this instance, and as well with SARS, it likely originated in an animal, spread to a human. We know that this really is centered around the seafood and animal food market in Wuhan, in China. Once it spreads to a human, the person then ultimately is able to transmit the virus to others. And I think we're seeing growing evidence that there is person-to-person transmission. We know that people are incredibly mobile. We can travel around the world in just a matter of hours. And so ultimately, this virus really starts to spread as people move across the globe.
What would you like to see Canada do in terms of screening to limit the spread of the virus, Doctor?
Well, there are some measures that are taking place, as you've already highlighted, in select airports, really to educate individuals who might be arriving from Wuhan about the illness and what to do should they develop symptoms, and also to present to the quarantine officers in the airports if they happen to be feeling unwell. I think the more important and more likely scenario is that if someone's infected, they're going to wind up in a hospital in one of our cities. And so this is really important now for our hospitals, our frontline healthcare workers to be on heightened alert for this particular virus so that we don't have a situation where one case infects a healthcare worker or leads to an outbreak in a hospital or even worse, potentially in our cities.
And with so much cold and flu going around right now, how do you know if you have something more serious?
It is really tough, as you've highlighted. This is something that just produces fairly non-specific types of respiratory symptoms and fevers. This is the time of year where many of us have those kinds of illnesses. I think the main issue really at this point in time is a link back to someone who has traveled in Wuhan, where the outbreak appears to be centered. But it is becoming a little bit more challenging because we are seeing now that the outbreak is starting to spread to other cities within China, into international places like Bangkok and Seoul and Tokyo. So this is an ongoing challenge that we're going to have to adapt to.
Dr. Khan, thank you so much. Glad you could be with us today to explain all of this. We appreciate it.